Hello everyone, myself Kavya, first year BHMS. So I have seen many students facing problem in applied anatomy questions. So I made this video of covering all the thoracic and upper limb applied anatomy questions. So let's begin. In this video, I have covered most of the applied anatomy questions of the thorax and the upper limb. If you want notes of these questions, you can follow my Instagram account and the link is given in a description box. First one, angina pectoris. It is a incomplete obstruction usually due to spasm of a coronary artery causes angina pectoris, which is associated with agonizing pain in a pectoral region and down the median border of a left arm and a forearm. In this picture, you can see the angina pectoris. The pain in a median border of a left arm and a forearm. Second one, it is angioplasty. It is a removal of small blockages from inserting a catheter from femoral artery and from aorta and into the coronary artery. Next, aortic aneurysm. It is a balloon like a bulge in a aorta. Next, bronchial asthma. It is due to the bronchospasm of a smooth muscles in the wall of the bronchioles, which causes difficulty in expiration. Next, it is Boxer's palsy or Bell's palsy. It is injury to the long thoracic nerve, which causes Bell's palsy. Next, carpal tunnel syndrome. It is a dislocation of lunate leading to carpal tunnel syndrome, which causes compression of medial nerve. Here in this diagram you can see carpal tunnel syndrome. Next one, cleidocranial dysostosis. It is the clavicles may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis. It causes the shoulders drop. So here in this picture you can see the cleidocranial dysostosis. Next one, Colles fracture. The radius commonly gets fractured about 2 cm above its lower end. So in this picture you can see the radius, lower end of the radius is fractured. It is called Colles fracture, and in case it goes anteriorly, it is called Smith's fracture. If it goes upwards, it's called Colles fracture. Next, crutch paralysis. It is radial nerve damage in a region of radial groove by the pressure of a crutch. And Saturday night palsy. It is also same as a crutch paralysis in which radial nerve damage in a region of a radial groove by sleeping in an armchair with a limb hanging by a side of the chair. Next, complete claw hand. It is due to the injury of lower trunk of the brachial plexus, especially the roots. The injury is called Klumpke's paralysis. Next, cubital tunnel syndrome. It is ulnar nerve get interrupted between the two heads of the flexor carpi ulnaris. Next, dextrocardia. It is when apex of the heart lies on the right side. It may occur in a condition called situs inverticus. Next, dislocation of shoulder joint. It is most commonest and it is due to laxity of the capsule. Next, dysphonia. Dysphonia, it is difficulty in breathing. Next, Erb's paralysis. It is injury to the upper trunk of the brachial plexus which causes Erb's paralysis, in which muscles which are paralyzed are biceps brachii, deltoid and brachialis and brachioradialis, which is also known as policeman's tip hand, which looks like this. It is called Erb's paralysis. Next, girdle pain. It is irritation of intercostal nerve causes severe pain which is referred to the front of the chest. Next, hemothorax. It is presence of blood in the pleural cavity. Next, hydropneumothorax. It is presence of both fluid and air in the pleural cavity. These two are the most important questions. Next, Klumpke's paralysis. It is injury to the lower trunk of the brachial plexus which causes claw hand. Next is lymphangitis. It is inflammation of a lymph vessels which is known as lymphangitis. Next, mediastinal syndrome. It is compression of a mediastinal structures by a tumor gives a group of symptoms which are dyspnea, dysphagia, dysphonia and engorgement of veins. Next, esophageal varices. In a portal hypertension, the communication between portal and a systemic veins draining the lower end of the esophagus which dilate. In this, these dilations are called esophageal varices. Next is pericardial effusion. The collection of a fluid in a pericardial cavity is referred as pericardial effusion. Next, pigeon chest. It is forward projection of a sternum like a keel of a boat and flattened of a chest wall on either side. Next, pointing finger. Injury to the branch of anterior interosseous nerve. In this, index finger remains extended and keep pointing forwards. So, in this picture you can see the pointing finger. Next, student's elbow. It is characterized by the effusion into the bursa on a posterior surface of the olecranon process. So, in this picture you can see the student's elbow. Next, tennis elbow. It occurs in a tennis player's abrupt pronation with a fully extended elbow may lead to the pain and tenderness over the lateral epicondyle. So, in this picture you can see tennis elbow. Next, tracheoesophageal fistula. It is improper separation of a trachea from esophagus during development. In this picture you can see tracheoesophageal fistula. Next one, tracheostomy. It is a surgical procedure which allows the air to enter directly into the trachea. Next one, Ullmann's ischemic contracture. It is caused by the occlusion of a brachial artery. So, in this picture, this one, you can see the Ullmann's ischemic contraction. In this, clawing of a fingers and a thumb occurs. Next one, winging of scapula. It is due to paralysis of serratus anterior. In this picture, you can see winging of a right scapula. Last one, that is wrist drop. It is paralysis of a radial nerve in a axilla or radial sulcus or paralysis of its deep branches in a cubital fossa. You can see here the wrist drop. So I have covered most of the applied anatomy questions on thorax and the upper limb, and I am going to make the part 2 video which is covering all abdominal and the lower limb applied anatomy questions. If you really liked the video, then give a thumbs up. Thank you for watching. Keep supporting.